Hello ATF team, Dr. J here for another ATF Breakout. I know, you're looking at your FFP this week and you're thinking it's more of the same. Again, please, just be patient with us. Realize always, again, there's always a method to the madness. We're really trying to establish that mobility. Remember, that's the foundation for everything we do with ATF. If we don't establish the mobility, all we're doing is building on dysfunction. And that's the whole key here, is to create a more functional you. This is the Academy to Function. So you're going to see a lot of the same stick rolling, a lot of the same ball rolling. That is that inhibition of those tender trigger points, and it's that lengthening of those restricted tissues. But again, what you're going to see this week is, again, I know it's only one or two exercises on your FFP, but you're going to see that we're integrating the core. And now to start to make that transition where we're getting into that activation phase. We're going inhibition, right, lengthening, and then we're moving on to this activation, getting those muscles to fire, and that falls into, again, our four-part continuum: mobility, stability, strength, and dynamic movement. So that mobility piece is done through that inhibition and the lengthening, and the stability is really done through core strength. So again, on these core exercises, you're going to see still we've added a dead bug exercise, which is integrating. You had done the marchers, you had done the Tin Mans, and it's taking that and you're integrating them at the same time. It's just that we're taking gravity out of it because we have you on your back. And it's really important that you execute and you really master that draw-in maneuver. You have to learn to rock those hips up and flatten that back. We have to get that spine stabilized and neutralized. If we don't do that, again, we're just going to build everything we do on a platform of dysfunction, and that's not what we are about. So practice that draw-in maneuver. It's really important. Again, I realize the dead bug exercise is just one little component, but it's a very important piece to what it is we're trying to establish here. You also see that we did add the floor cobra. This is a prone position or a face down position, and again, I want to emphasize on that you squeeze the buttocks, okay? You got to squeeze the glutes, okay, and you have to squeeze the shoulder blades. That's the key here. This is a piece where we're starting to work on what we're going to call scaption, which is we're trying to reestablish that plane in which your shoulder blades move. Many of us, again, we're in that U1 posture, and we had problems with our shoulders and we have problems with our neck. We have to retrain that scapulothoracic, or that shoulder blade and upper thorax joint, to learn how to they need to learn how to integrate and move with one another again. And again, if you're U1, that's why you see us starting to implement some more of these Indian club exercises, because we have to teach that joint along with the shoulder, because remember, the shoulder blade and the thorax is a joint, just like your shoulder, the ball and socket, is a joint. And a lot of times that's where the problem lies, is actually with the shoulder blade and the upper thorax. So again, I realize it's only just a couple exercises, but we've got to start somewhere. And if we don't establish the mobility first, then it's all for naught. So again, we're seeing this week, this is week 4, which is the last week of our cycle. This is cycle 1, remember. Week 4, we're still seeing a lot of the mobility. The inhibition with the trigger points on the ball rolling, stick rolling, and the lengthening with a lot of stretching, and just a little component of core strengthening. But we're going to be moving next week. We're going to get a lot more into core stabilization and this activation piece where we're working on stability. So be patient with us. It's going to start to change here over the next 4 weeks. And that's going to be really important to our progression. So remember, just be patient. There's always a method, and there's a reason that we're doing all this, and as long as you're patient, you're really going to see the outcomes. And if you're still struggling, remember, do these things on your time. They're 15 minutes. Do it in work breaks, small times. When you feel that tension coming on, just use the ball, use the stick, and use that as that deep tissue massage. And remember, again, make sure that we're always drinking plenty of fluids, maybe getting a little bit of cardio in there. And you'll see on this week that the cardio actually upped a little bit. We're in zone 2, which is 75% of your max heart rate. So we've upped that a little bit this week. We want you to get a little bit more active. And you know, we got the holidays coming up, so what better way to kick off the holidays than to have a little bit of extra cardio in there to work off that turkey and the stuffing and all that good stuff on Thanksgiving. So on behalf of the Academy to Function, we want to wish you all a happy Thanksgiving, and we hope that you continue to enjoy the videos and work through each one of these. And remember, we're always here to help you function better in your world.